sports medicine physician, and today I'm reviewing Grey's Anatomy Best Moments of Season 1. Because, like, you guys have asked for it, like, only a bazillion times. Please react to a TV show. Okay, freaking here it is. I'm gonna react to a TV show.
Oh no! Oh yeah!
Where were we at?
What?
I was reviewing Grey's Anatomy, the best moments of Season 1. So let's get back to it. For this next scene, we have one of the interns who is requesting an opportunity to assist in the OR. And we spoke a little bit about this before.
Dr. Bailey, I was hoping to assist you in the OR today, maybe do a minor procedure. I think I'm ready.
Here she tries to suck up to the resident. That was rule number 1, don't break rule number 1, by getting her a coffee and trying to be real nice. And then she asks her whether she is able to perform a procedure or assist in the OR because she thinks she is ready to do so.
Mocha latte?
If she gets a cut, I want to cut too.
Yeah, me too.
I wouldn't mind another shot. I mean, if everybody else is.
Stop talking.
So as I said before, interns and junior residents don't typically ask to perform procedures in the OR. And I cannot see this happening unless the intern or the junior resident was extremely confident in themselves. And it's not to say that they wouldn't be ready to perform that procedure, but they would not be given the opportunity to perform that procedure until they had demonstrated certain things.
Every intern wants to perform their first surgery. That's not your job. Do you know what your job is? To make your resident happy.
Usually what will happen is that you will be given parts of a procedure to do first.
You know what will make me look happy? Having the code team staffed, having the trauma pages answered.
For any procedure, there is an opening, there is the preparatory work for the procedure, there is the procedure itself, and then finally, the closure. Typically, what will happen is that the senior resident or the attending physician will allow you to perform one of the more minor aspects of the surgery, such as the closure or the opening of the procedure.
Having the weekend labs delivered and having someone down in the pit doing the sutures.
And usually they'll allow you to do this aspect of the procedure for a few times to demonstrate your comfort and your competence. Once you've performed this procedure satisfactorily enough times, they'll give you an additional part or a different part of the procedure to perform. Over time, you will have performed all parts of the procedure, but independently. Finally, once they are comfortable that you are able to perform all aspects of the procedure independently, then they will allow you to perform the whole procedure in one sitting. Well, sort of. Because there are always time constraints in the operating room and in the hospital. The surgeon has a certain number of cases that they are supposed to perform on any given day. And they want to make sure that they are able to perform those cases without having any of those cases canceled because of time overrun. Being able to perform those procedures competently is only part of the equation. The other part of the equation is being able to perform those procedures in the amount of time that is available. Even though you can do all parts of the procedure, if you're doing them too freaking slowly, the surgeon, yikes, is gonna take the knife. And you never want the surgeon to take the knife. Make sure that you can do it right and make sure that you can do it quickly.
No one holds a scalpel till I'm so happy I'm Mary freaking Poppins.
So in this next scene, we have the resident who is walking down the street and she happens to meet up with her attending.
Morning, Dr. Bailey.
Shut up.
You realize that I'm an attending and you're only a resident.
A certain level of animosity here, and this is kind of true in medicine. Although there are lots of attending physicians whom we admire and whom we like, often there is a certain degree of animosity between the attending and their staff, because basically the staff are all the people that do the work for them, and oftentimes, although this is not universally true, oftentimes the attendings don't show any appreciation. And this may be because some of them are just jackasses and they just don't really care. But also it can happen because they are just freaking busy. They have a lot on their plate, a lot to think of, a lot of responsibility, and oftentimes it just doesn't even enter into their mind to say thank you for all the things that their junior staff does for them. So we can see here there's a certain degree of animosity.
Yeah, you work for me, right?
I know I've forgotten something. Something is happening today. I know I should know what it is, but I just can't.
And as the scene progresses, we can see that the staff guy, whatever his name is, McDreamy, Steamy, Patrick Dempsey, that guy, he walks out into the street without paying attention.
All right, nice talking with you, Dr. Bailey.
It's right in front of my face.
But fortunately, in the nick of time, his resident grabs him and pulls him back and saves his bacon. So this is basically a metaphor for what happens in the hospital, because although there is animosity between the chief and her attending, she, in the nick of time, reaches out to save his bacon. And this is basically what happens in the hospital. As I said, the attending is often quite busy, there's lots of things going on, and sometimes things get missed. But fortunately, the attending has a team of competent physicians working for him, and whenever something falls through the cracks, those staff members are there to catch it before it falls to the ground and crashes in a blaze of glory. So in this next scene, we have the senior resident giving a lecture to what appears to be the friends of somebody who has been admitted to the hospital. And she's basically giving them a lecture about, the kinds of stupid things that they do that cause their friend to be admitted into the hospital. Because, it appears that these guys, or these friends, are making light of what happened.
What's his name?
Viper.
Viper.
Yeah, we were in the race.
How is he? Is he okay?
Yeah.
Is he okay?
And they seem to underestimate the severity of the injuries suffered by their friend.
No, he's not okay at all. He hurled his body down a concrete mountain at full speed for no good reason.
So one thing that I can say after being a practicing physician for 10 years and one who has had trauma as an active part of my practice is that people do stupid things. And oftentimes their friends who have brought them into the hospital after they've done something stupid will underestimate the severity of what has transpired.
You want to kill yourselves flying down a concrete mountain? Go to it. But there are other people walking.
And so this portrayal is quite accurate, at least in terms of their behavior, because it's quite frequent that people really don't get the severity of what's happened and what this might mean for their friend or for their loved one in the future.
And one of them got his brain scrambled today because one of you little sniveling no good snot rag.
Now, typically a resident or a physician or even a staff person is not going to talk to people in this manner because there are lots of issues with how the public perceives us as medical personnel. And so generally, this type of interaction would not be seen in a positive light by the administration of the hospital. However, there is an element of truth here in what she is saying. As I said, people do stupid things. But when they do stupid things, we as physicians or as the medical field have to work hard to help to fix those people and restore them back to normality after they have injured themselves. Resources that would otherwise be used to help people who had inadvertently become ill or injured are now diverted away to help those people who have done those stupid things. Since most of these stupid things that people do are typically avoidable, it would be nice to not have to spend money on them so that we could save that money to be spent on the people who actually really needed medical attention. So the moral of the story is just try not to do stupid things.
Yes, so, okay, no. Your friend Viper, as far as I'm concerned, is not okay.
Okay, so for this next one, we have the chief resident performing morning rounds with the intern, and she's rhyming off the room numbers of all the post-operative patients that the intern needs to see.
Stops in 1337, 3342, 3363, and 2381.
Now, generally, yes, we would perform morning rounds first thing in the day before we have any other clinical responsibilities. So this means typically we're going to be rounding at 6 o'clock because the day is going to start at 7 o'clock. So we would be doing this, but these days, most everything is on EMR or electronic medical records. So that means it's on the computer. So you would never have to just sort of memorize room numbers or write down the room numbers, because typically you're going to be able to go to the computer and get a list and print out a list of the patients for your physician, and then you could carry that piece of paper with you, and Bob's your uncle. You have a list for the remainder of the day.
3342, 3363, and 23.
Unless that, of course, changes because you have new admissions or discharges. But basically speaking, you're not going to have to write stuff down. At least not that.
Why are you still standing in front of me?
You won't have to write the list down. Okay, so for this next clip, we have some OR banter between the resident and one of the interns. And they're talking in the operating room at the completion of a case.
Christina and Izzy, I think they're already swamped.
With what?
Labs. They had to check on some labs.
And I think that this is interesting for several reasons. So the first thing that I think is interesting, and as I said, I don't like these shows because they don't portray things accurately. So the first thing that I don't like is that the chief resident, she should know better, she took off her mask first before anything else.
Oh, you are lying.
And this is bad for several reasons. So, number one, before the wound is closed and you have an adequate dressing on the wound, you would never want to take your mask off because obviously there are bacteria that can come out of your mouth and that could fall into the wound or onto the surgical field. So you would never want to take your mask off before the wound had been covered with an adequate dressing. We can't exactly see this wound, but I don't get the impression that they were entirely finished yet because you saw the intern with some gauze in her hand.
They had to check on some labs.
Before the screen cut away to the chief resident taking her mask off. So you wouldn't want to do that. The way that it works is this. So number one, you take your gown off. If you have a reusable gown, then one of the assistants or one of the nurses in the room will help to untie the back of the gown. You will take the gown out from inside out and you will leave your gloves on. Then, once you've put the gown in either the garbage if it's disposable or into the laundry if it's reusable, then you will take the gloves off. And there is a particular way to do this because the outside of the gloves are soiled and you do not want to soil your skin with the blood or whatever's on the gloves. So there is a particular way in which we do this. You will next take the gloves off. You still have the mask on your face. And then lastly, once you've taken the gloves off, you will take the mask off and you will throw that into the garbage because typically the masks are disposable. So this is the order in which you'll do it. And we do it this way so we are sure not to contaminate ourselves with any of the stuff that has come from the patient, whether that be blood or any other kind of bodily fluid. So that's the order, and she screwed it up. She's the chief resident. She should know better.
I know you're lying. You know how I know? Because you're a bad liar. Take over for me. I know exactly where they are. Here, take over for me.
And so for this last scene, we have two of the interns in a room performing what appears to be a freaking autopsy.
Don't even tell me you're doing what I think you're doing.
Like, did I just see that? Like, holy crap.
Not only did you disregard the family's wishes, you broke the law. You could be arrested for assault.
No, and a freaking hell no.
Do you like jail? The hospital could be sued. I could lose my license. My job. I like my job.
Not gonna happen. Don't do that. That is absolute craziness.
Did you think about any of this before you started cutting open a poor man's body?
Okay, so this is a TV show, so they can show whatever they want in a TV show. But this is the kind of thing where you would be kicked out of the program. You would lose whatever medical license you had if you were to do this. So this would not happen. And not only would it not happen, but the ability for this to happen would be like slim to next to none. You know what I mean? Because the access to the morgue is going to be limited, and probably it's going to be monitored and controlled by card access. So you're probably not even going to be able to do that or go there unless you were a pathology resident, in which case you would be doing the autopsies. But as a surgical resident, you would not be doing autopsies. That just not going to happen unless your staff person is a surgical pathologist. But again, not going to happen, and you're never going to be doing that unattended or in. It's not just something you're gonna do. Hey, let's just go do an autopsy on this guy because.
You know, I could seriously kick both your asses right now. Do you have anything to say?
Also, it appears in this scene that the family specifically said that they did not want the autopsy performed. So you would never be doing something that went against the family's wishes unless it were a particular case where an autopsy was mandated to be performed. There are particular occasions when people have a certain illness or when a death has occurred in an unusual manner where an autopsy is mandated by law to be performed. And in those cases, even if the family did not want the autopsy to be performed, it would be performed by the surgical pathologist. However, in all other circumstances, if the family said that they did not want the autopsy to be performed, then it would not be performed. And if you, as an intern, decided that you were going to do it anyway...
Look at his heart.
It's huge.
It's over 600 grams, and there's some kind of grainy material in it. We want to run some tests.
Oh, now you want to run tests.
That would probably be your ticket out of the program. So what are some of the takeaways that I can give you from the clips that I have reviewed today? So number one, residency is hard freaking work with little outward reward. You need to be intrinsically motivated to survive. Number two, success will come from being part of a team. And this includes doing your job well, adequately demonstrating your competence, and respecting your fellow teammates and patients. And lastly, number three, there is a definite hierarchy in medicine. Hard work and competence will determine your progress from level to level. So if you're new to the channel, be sure to subscribe and hit the notification bell. If you like the video, be sure to give it a big thumbs up and share it with somebody you know. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Yeah.